Our next topic will be on perioperative nursing. So what are examples of post-operative complications? So one, we have hemorrhage. Two would be paralytic ileus, pneumonia and atelectasis, constipation, shock, hypoxia, urinary retention, thrombophlebitis, pulmonary embolism, wound infection, wound dehiscence, and lastly, that would be wound evisceration. So this slide shows you the different types of post-operative complications, and we'll be discussing them one by one. So the first complication is going to be hypoxia. Our main assessment finding in hypoxia is going to be restlessness, tachycardia, shortness of breath, and then also confusion. Our main interventions will be providing the patient oxygen, the use of the spirometer, and also encouraging deep breathing and coughing. Now we also have another complication is going to be pneumonia and atelectasis. Atelectasis happens because of the accumulation of mucus that blocks the airway of the patient. So remember that these are complications that may happen, especially if the patient had a long hours of surgery and mucus accumulates in the pulmonary system. And also very important is to allow the lungs to expand after the surgery, because it's possible that atelectasis may happen. Now, so our assessment findings will be shortness of breath, tachypnea, crackles, chest pain, and also a productive cough. And our interventions will be to turn the patient, encourage deep breathing and coughing, and also early ambulation to promote pulmonary function. Now, another complication is going to be hemorrhage, and these are all the symptoms of hemorrhage, or the signs and symptoms. So the primary manifestation or assessment in hemorrhage will be restlessness. That is always the first one. So you also have weak, rapid pulse, cool, clammy skin, tachypnea, oliguria, and also hypotension. And our intervention for hemorrhage are going to be application of pressure to the site if the surgical wound is bleeding, and also to notify the registered nurse if you are the RN. Another complication after surgery is shock. Shock basically means that the patient lacks circulating oxygen. So our assessment finding will be restlessness again. Then we also have hypotension, tachypnea, tachycardia or increase in the heart rate, and also cool, clammy skin. Now, except in sepsis, because if sepsis occurs, there's actually going to be warm skin instead of the cool, clammy skin. Our interventions for shock are the following. We have a modified T position. Modified T position means modified Trendelenburg position, wherein only the lower extremities are being elevated to prevent the gastrointestinal organs from causing pressure on the respiratory organs. So basically, the modified T positions allow maximum lung function while elevating the legs to promote venous return and prevent shock. Now, another intervention for shock definitely is to provide the patient oxygen, and if you're the LVN, you have to report the situation to the RN. Another complication is going to be constipation. So our primary assessment findings are the following. It would be abdominal distension, anorexia, and headache. For interventions, check the bowel sounds, provide fiber-rich foods, stool softeners, and encourage the patient to drink at least 3,000 ml of fluids per day. And of course, lastly, that would be early ambulation to promote peristalsis. Now, another complication is going to be thrombophlebitis, or the inflammation of the vein due to clot formation. Now, our assessment would be a positive Homan sign. Now, what is a positive Homan sign? That is the pain behind the knee when the foot is being dorsiflexed. And also other signs of thrombophlebitis would be a tender and warm area on the extremity of the patient, and also swelling of the extremity. These are all the interventions for thrombophlebitis. It includes elevating the extremity to promote circulation and venous return, avoiding pressure on the popliteal area, so it's important not to put anything behind the knee. Also, avoid dangling of the legs. We also apply a pneumatic compression device. A pneumatic compression device is a special device being applied on the extremity of the patient to provide continuous pressure that will prevent the formation of the clot by promoting circulation. We also encourage turning and repositioning, use of anti-embolism stockings, and lastly, that would be PROM, or the passive range of motion of the extremity. Another complication will be pulmonary embolism, which is a medical emergency as well. So the primary assessment for pulmonary embolism would be sudden sharp chest pain, especially if it happens suddenly without any explanation. Then we also have shortness of breath and also pallor to cyanosis. Our interventions basically will be to notify the registered nurse right away if you're the LVN, and provide the patient oxygen definitely to prevent hypoxia. Another complication of surgery is urinary retention. Our assessment findings for that will be a lower abdominal pain, distended bladder. The bladder sounds like drum on percussion, and also hypertension. And one of the ways nowadays also to assess for urinary retention and to check for the amount of urine in the bladder is the bladder scan. So it is an ultrasound equipment that is able to measure the amount of urine left in the bladder, especially if we are measuring the PVR, or the post-void residual of the patient. Now, our interventions for urinary retention will be to measure the patient's intake and output, and also to pour warm water on the perineum to stimulate urination, encourage fluids, and in the worst case scenario is to do a straight catheterization or an in and out cath. Another complication after surgery is the wound infection. So these are all the symptoms of wound infection. We have fever, warm and tender incision site, edema, and purulent drainage. Now, for interventions, we have to assess the site properly using the RIDA technique. RIDA basically means R stands for redness, E stands for edema, E stands for ecchymosis or bruising, D stands for discharge, and A for approximation. And of course, we also give antibiotics for wound infection. Another important complication is your paralytic ileus, which is basically the lack of peristalsis after surgery. Our assessment findings are the following: nausea and vomiting, absent bowel sounds, failure to pass flatus, and also abdominal distension. So all of these three usually are usually found in the NCLEX exam. So it's very important to assess the patient for paralytic ileus after surgery. Now, our interventions for paralytic ileus are the following. Patient should be placed on NPO until the bowel sounds return, and also encourage the patient early ambulation to promote peristalsis. And if in case the patient has an NG tube, it's very important to maintain the patency of the tube to prevent abdominal distension. Another complication is wound evisceration. Wound evisceration is an emergency, and basically it's the protrusion of organs when the wound splits open. So another assessment finding will be the presence of serosanguinous fluid, and also the patient will say there's a feeling of popping sensation. And the intervention basically is the same as dehiscence, which we will be discussing. So let's now go and discuss your wound dehiscence. Okay, so wound dehiscence basically is the opening of the wound edges. So our interventions for that is to notify the RN if you're the LVN. Place the patient in a low Fowler's position with the knees bent, and the purpose of this is to prevent the wound from splitting further. And also, very important is to cover the area or the wound with sterile normal saline to prevent infection. And that's the same intervention for wound evisceration. And of course, the intervention for this complications will be to perform surgery to correct the problem. So there you go, everyone. These are the common complications or possible complications after surgery. Okay, so this ends our lecture presentation, and thank you very much, everyone.